Since our founding in 1978 as a gay men's health clinic, Chase Brexton has been a beacon of hope to patients seeking affirmative care, support, and a healthier life. From those earliest days as a volunteer-run clinic to the state-of-the-art health center we are today, our caring, compassionate staff has never forgotten that our patients are at the heart of all we do. As we look forward, we remain fixed on our mission to provide compassionate, quality health care that honors diversity, inspires wellness, and improves our communities. In response to the need for safe, specialized care, Chase Brexton was founded in 1978 as a volunteer-run gay men's health clinic housed at 2233 St. Paul Street in Baltimore's Mount Vernon neighborhood. We would move several times in the coming years. In 1979, we moved to 2133 Maryland Avenue, joining what would become the Gay and Lesbian Community Center of Baltimore, or the GLCCB.
First thing I would say is, as a patient, what I remember is that a lot of the providers were volunteers, which is very different than Chase Brexton for the last 10 or 20 years. So these were particularly physicians who would work all day someplace else and then particularly at night come and serve the population. Because if I recall, most of the hours of Chase Brexton at that time were actually in the evenings, as opposed to a 9 o'clock or 10 a.m. type of thing.
When the clinic and the GLCCB moved to 241 West Chase Street in 1981, the volunteers found our name. The building sat at the intersection of Chase Street and Brexton Alley. The new building and new name came at a critical time in our history. A little understood, deadly disease was ravaging our patients and the gay community in Baltimore and nationwide.
I mean, it really was to a point where you would have people that you knew getting infected around you, and you would wonder, okay, is it going to happen to me now? But also, you know, I mean, you could go back through and look through your Rolodex or your address book, and you could see, okay, this person's no longer with us, and this one's no longer with us, and this one's dying, and so on. So you had that sense of, you know, urgency. We need to figure out what's going on, we need to address it, and we need to do everything we can to help folks who are in this situation to see if we can't possibly find a cure, find a vaccine, or find some way to treat and keep people alive.
Terror was truly the word. It wasn't discomfort, it wasn't concern, it was terror. Because you didn't know what you may have had, and yet you knew people were very, very sick and lots of people were dying. And you know, if you think about the early 80s, the mid 80s, the country was not necessarily as accepting maybe as it is today. It was, you know, it was truly the gay plague, if you talk about HIV, if you talk about AIDS.
And I remember I knew a guy that lived up in Bolton Hill, and I went in to draw his blood, and he didn't have long to go. He passed the next day. And we didn't know what was happening, but I had picked this up from a doctor and stuff, and the doctor just took his gloves off and touched the guy, and I just followed suit, and we didn't know. But I just thought, how sad to go on and never feel skin again.
As HIV and AIDS devastated Baltimore's LGBT community, Chase Brexton earned a reputation as a first responder, providing critical care that was both groundbreaking and individualized to each patient's unique needs. This expertise, along with increasing needs in our community beyond HIV treatment, set Chase Brexton on a path of growth that continues today. We began adding new services for our patients and their families and partners, and reaching out to new communities in need. Chase Brexton officially separated from the GLCCB in 1989 and incorporated as the Chase Brexton Clinic. The clinic grew rapidly in Mount Vernon, taking space first in the Medical Arts Building, and in 1994, purchasing the 20,000 square foot building at 1001 Cathedral Street, adding 10 East Chase Street later. Here, we improved upon our innovative HIV model of care, and even more, we established primary care, behavioral health and addictions, pharmacy, case management, and dental to serve all our neighbors. This growth, our financial stability, and a desire to meet the healthcare needs of everyone in the community led Chase Brexton to move beyond the bounds of the Mount Vernon neighborhood.
It was what was happening at the time amongst other nonprofits as well, you know, figuring out the ways so that they could be self-sustainable. And when you looked at it from that perspective, from the business perspective, it became a no-brainer that we've got to move in this direction or eventually face the fact that you may close the doors.
I think one of the things that really added to this, and this is to the credit of those board members at the time, is they were very passionate, and they were particularly very passionate about their patients. And they didn't want any decisions made that negatively impacted those patients. And that was also helpful as a relatively new person, as a non-clinical person to the organization, to appreciate how important that commitment was to the existing patients. So hopefully any decisions that we made going forward honored both what we did at the time and also helped to serve more people in as good a way as possible.
We really felt that, Chase Brexton was all that we had. But in order to grow and give the medical care that people needed, we needed to grow.
Chase Brexton opened a new location in Pikesville in 1999, which moved several times before settling into its current location in Randallstown. Then came Columbia Center in 2006, Easton Center in 2007, and Glen Burnie Center in 2014. In Mount Vernon, we purchased the nearly 100,000 square foot Monumental Life building in 2011, securing Chase Brexton's place in the neighborhood for years to come.
Well, it was very interesting the way it worked out. I mean, because we always found pockets of individuals that needed care and that were backing. So it felt good to the fact that we were able to help in those areas that really needed some assistance. They were not getting it at the time.
Through it all, we have never forgotten Chase Brexton's legacy, or those who fought and lost the battle to HIV and AIDS. Today, Chase Brexton Healthcare continues the commitment made by our founding volunteers. Whether gay or straight, transgender or cisgender, uninsured or insured, new to the community or new to the country, Chase Brexton provides safe, welcoming, expert healthcare to all.
I don't think it's an either or zero-sum game, because we're going this way, then LGBT issues go this way. I don't think that's the case.
We wish we could reach more because we know that there are a lot of people out here who don't have the opportunity. They don't have health care. And for whatever reasons, either they can't afford it or they're not in an area that offers it. It's sad to think that that in this country or in this city that we can't give that to everyone.
But it was important for me to let the community and other people know, just because you walk through that door doesn't mean you're gay, doesn't mean you're HIV positive, that whomever you are, you're going to get the same care.
Chase Brexton, since 1978, providing compassionate, quality health care that honors diversity, inspires wellness, and improves our communities.